Senator from Tennessee.
Mr. President, let me pick up where the distinguished senator from Oklahoma ended. This Senate and the House are capable of doing some awfully good bipartisan work that helps the American people, and we do a lot of it. The senator from Louisiana, the presiding officer today, has been working with the senator from Connecticut, a Democrat. They have different political persuasions. They've got us very close to passing a very important mental health bill in the United States Senate, one that passed the House yesterday. They've worked hard on that. We're going to get that done this year. I'd like to do it next week, but if not, we should be able to do it in September. Earlier today, I went to the National Education Association annual convention where there were 10,000 teachers from all over the country. And they gave the Friend of the NEA Award to Senator Murray of Washington State and to me. 30 years ago, when I was governor of Tennessee, I would have gotten the Public Enemy of the NEA Award. But what they liked, and what teachers and governors and chief state school officers and parents liked, was that last year we came together and fixed No Child Left Behind and stopped Washington from telling schools so much about what to do and restored that responsibility where it ought to be to teachers and to class and to parents and to governors and to legislators. And we've been being thanked for that because it affects 50 million children and 3.5 million teachers in 100,000 public schools. We did our job. So that's mental health. There's Fix No Child Left Behind. We're working on something called 21st Century Cures. The House of Representatives has passed it. Again, the senator from Louisiana has been working on an important part of it, having to do with electronic medical records as an example. But this has the opportunity of being by far the most important legislation we pass this year, and we will pass it because it's part of Speaker Ryan's agenda. The majority leader, Senator McConnell, wants to pass it. The President of the United States is interested in it because of his focus on precision medicine and the Vice President's focus on cancer moonshot. There's funding for the Brain Initiative there, which has to do with Alzheimer's. These breathtaking discoveries that we're on the verge of in America that would affect millions of people, research for that, and then moving them through the regulatory and investment process and into the medicine cabinets. I saw a Forbes poll the other day that showed 82% of the American people would like for Congress to do more on biomedical research. They agree on that. We are doing that. So there are three things: fixing No Child Left Behind, mental health, 21st Century Cures, and then we get to opioids and we get to Zika. Now, what's happened here? I mean, this reminds me of the Hatfields and the McCoys in the mountains of Kentucky and Tennessee. They fought so long, they forgot where they were fighting. They just killed each other because that's what their grandfathers did. We have two issues here of intense interest to the American people, and we're on the verge of a significant step to help. The first is Zika. The Zika virus is terrifying young women in our country. They're postponing their pregnancies. They're afraid to have babies. They're afraid they'll be born in a deformed way because we find that if you have the Zika virus, some women have babies who have deformities when they're born. There will be a vaccine for this by 2018, perhaps. That's part of the 21st Century Cures initiative I was just talking about. More money for the National Institutes of Health to speed that along. But between now and then, we need to take every step we need to take to help keep the Zika virus from infecting as many people as we can. This is a very simple disease. It's carried by a mosquito, and if the mosquito bites you, you get the Zika virus. And for many people, it makes no difference, but for pregnant women, it could be a problem. So it is July, and the mosquitoes are out, and it's time to eradicate the mosquitoes. And so the Centers for Disease Control has asked us for money, and so we've passed $1.1 billion here for money for Zika. $1.1 billion we're ready to pass, and because of a small provision, which the House of Representatives put in, that has to do with who's a Medicaid provider in Puerto Rico. There are many Medicaid providers in Puerto Rico who can go about this business in July and August and September to deal with trying to keep the mosquitoes away, our friends on the other side of the aisle won't let us pass the bill. Now let's stop and think about this. This is Hatfield and McCoy's at its worst. This is not the same spirit we had fixing No Child Left Behind. It's not the same spirit we have working with the President and Speaker Ryan and Senator McConnell on 21st century cures. It's not the same spirit that Senator Murphy and Senator Cassidy have shown in taking grave differences over mental health and putting them in a way that we'll get some advances on that this year. There is no excuse whatever for delaying spending $1.1 billion to help pregnant women and other families avoid the Zika virus this summer. We don't need mosquito control in the winter. We need it in the summer, and we need to pass it now before we leave and go away on our recess and come back in September. And there may be a provision in the bill that some of us would have written a different way. Maybe some of us would like some more money. But the provision that's offensive to some people is a very small provision. There are Medicaid providers all over Puerto Rico who can deal with this part of the money. And there is no excuse for not approving the $1.1 billion that we're ready to spend for Zika, period. And it's wrong for the Democrats to block that. It's wrong as it can be. And it's not in the right spirit. I think I have a reputation here for trying to get results, and I would say to my friends on the other side of the aisle, please stop thinking about this. This is the Hatfields and McCoys example that the American people really don't like. And we're on the verge of doing something that would help a lot of Americans, especially young women, and we ought to do it. We ought to do it today or next week, and we surely should not go home without having done it. And then the other thing we're on the verge of doing well is helping deal with opioids. And again, we're in a Hatfields and McCoy situation, apparently. I hope we avoid it, but we may be, and I'd like to avoid that as well. We've talked a lot about the opioids abuse. I know what happens in Tennessee. Opioids overdose is killing more people every year than car wrecks or gunshots. Car wrecks or gunshots. I had a roundtable in Knoxville several months ago. It was filled with people, judges, parents, doctors, hospital managers. Everybody's overwhelmed with this. They want some help in doing it. We can't fix it from here, but we can support those on the front line. And we're doing it. We're making some changes. We've come back to Secretary Burwell, and the President said, change the provision on the pain management survey that hospitals are telling us encourage doctors to overprescribe opioids. Well, at first they didn't listen, but to the President's credit, to Secretary Burwell's credit, they did it. They listened, and they did it at the urging of Congress. They've increased the level of prescriptions that treatment doctors can prescribe. That was something that Senator Paul, Senator Markey, Democrats and Republicans in the House wanted to do. We might do more of it, but that was the TREAT Act. And then we came up with a bipartisan opioid bill in the Senate and in the House. It has contributions from half the Democrats, many of the Republicans, and the House. It passed 400-1 over there. Over here, it was 94-1. Pardon me, it was 400-5 in the House, 90-1 here. It has more than 200 groups across the country that says opioid abuse is an epidemic and a crisis, so let's fix it. So we have a substantial step to fix it. Yesterday, we approved a merger of what the House did and the Senate did, and both will come to the House and next week to the Senate for approval. You would think that something that had passed the Senate 94-1, when it comes back for approval, would pass again 94-1. You would think that something as urgent as dealing with opioid drug abuse, an epidemic, as I said again, killing more people every year in my state than gunshots, killing more people every year in my state than car wrecks, you'd think we'd want to do something about it, particularly when we've worked hard and we have a very good package 200 of the advocacy groups in this country who work on opioid abuse like what we've done. Well, what's the problem? Well, our friends on the other side say, you need to fund it. We are funding it, and they helped fund it. Over the last 3 years, count the last 2 Congresses where the money is already appropriated, in other words, it's there to spend, count the amount of money that the Senate Appropriations Committee has approved, we've increased funding for opioids already by 542%. For those working on their math, that's 5 times more than we were doing 2.5 years ago. And then the House of Representatives has come along today and say, we want to go even further than that. That's in the regular appropriations process. That's how we do our business here. For example, last year, as I mentioned, we fixed No Child Left Behind. The president called it a Christmas miracle. Everybody's happy about it. It doesn't spend a penny. It reformed the education law. We spend the money in the appropriations process. Every year we pass a defense authorization bill. It reforms everything that has to do with keeping us safe in the country, but we don't spend a penny. That's in the appropriations process. We have an energy bill we're going to go to conference on. Doesn't spend a penny. That's in the appropriations process. So we are spending money on opioids. We are spending money on opioids. 5 times increase over 2.5 years, in addition to policy that 200 groups support and that passed the Senate 94-1. Now, some say, well, there should be more. You know, I agree. I would like to spend even more for opioids. I'd like to see a more significant amount of money for state grants to help with opioids, because that's where the bottom line is. But there are a lot of discussions going on about doing that. There's some discussion about doing that in the 21st Century Cures Bill, perhaps. We talked about it, we even voted on it last year. Republicans put through a bill in our so-called reconciliation process in which all but 5 Republicans in the Senate and the House voted for $750 each year for 2 years for opioids. $750 each year for opioids. That's $1.5 billion Republicans voted for. The president vetoed it because it also repealed Obamacare. Well, we thought we were getting 2 good things: repeal Obamacare and support opioids. The president, of course, disagreed with that. So this isn't all on Democrats or Republicans, because we've also voted for more money for opioids. But let's get out of this Hatfield's and McCoy's posture in this last week or 10 days before the convention starts, when we're dealing with the lives of so many Americans. Every senator who talked yesterday at the conference report had some story of someone from his or her state who had died from an opioid abuse. Several from one family in several cases. Everyone has that story. Then how can we dare go home next week without having passed a policy that everyone who understands the subject says will help in terms of prevention and state grants and treatment and a variety of other things? And when we've increased funding by 5 times over 2.5 years, how can we dare go home without having passed that? Now, can we continue to talk about even more funding? Yeah, I'm ready to do that. I'd like to do it. I'd like to find a way to do it. But that doesn't mean we stop doing what we can do now. So I'm on the floor today, and let me just remind my friends on the other side of the aisle, this opioids conference is not a Republican bill. It's filled with Democratic priorities. Senator Whitehouse is the lead sponsor, the senator from Rhode Island. He's passionate about it. 44 Democratic senators voted for his version of it. Senator Warren is the lead sponsor of the Reducing Unused Medication Act. It's in the package. Senator Durbin led an amendment regarding the opioid action plan at the FDA. That's included. Senator Shaheen and 9 other Democratic senators led the National All Schedules Prescription Electronic Reauthorization, which is included. Congressman Sarbanes has a bill on expanding access through co-prescribing. Senator Casey introduced a plan of safe care improvement. That was included. Senators Brown, King, and Manchin are co-sponsors of a Healthy Babies Act that was included. Senators Brown, Kane, Casey, and Feinstein, co-sponsors of another provision. Look, we all put this together. We all care about it. The people we work for all need our help. We should pass it. We should pass it. And to come up with the lame excuse that we're not funding it when in fact we are, 5 times more over 2.5 years, that's not the kind of thing that will gain respect for the United States Senate. So I'm here today as someone who spends most of his time trying to get results in this body and often achieves results. I do that only because of relationships with Democratic members as well as Republican members. I told the National Education Association today to give Patty Murray a big hand for being the friend of the NEA on fixing No Child Left Behind, because it would not have happened without her. And I would say that when we pass the opioids conference, give a big hand to Senator Durbin and Shaheen and Congressman Sarbanes, and especially Senator Whitehouse, Senator Casey, Senator Warren, because they've all made major contributions to this. And they voted for the funding over the last 2 years. And I'm sure they will this year, which will go up at least 5 times. 5 times. So let's put the Hatfields and McCoys back in Kentucky and Tennessee. Let's say young women all over the country are terrified by the Zika virus. Let's spend $1.1 billion or make it available to the Centers for Disease Control now to help. And let's take this opioids conference report that we're on the verge of passing, that we're all for, and let's do it and go home. And let's add to the Fixing No Child Left Behind, the 21st Century Cures progress, the mental health progress, our work on opioids abuse, and our work on Zika. That would be what the American people would expect of us, and I hope that by the end of next week, we find a way to do it. I thank the President. I yield the floor.